I think MPACT is a very important initiative because it brings together some key stakeholders within healthcare: patients and families, hospitals, and physicians and provider organizations. And we know that in healthcare, we frequently have challenges in our outcomes because so much of our care is fragmented. So bringing together these three key components will really help us have a meaningful conversation. Focusing on transitions of care is a really vulnerable time for patients and families, and that fragmentation has tremendous consequences. So MPACT is a place where we can learn and grow and hopefully improve those transitions so they're better and more meaningful for our patients.
Being a part of a healthcare team looking at transitions of care is very important to me because I've been through a variety of experiences, some of which were very terrible and some were only mildly terrible. And I feel that a look at the systems that are involved in the process and the people who are part of it can be looked at and help the patient and help the system to be more profitable, more productive.
This is a great experience and a great opportunity to be a part of. Involving patients in feedback for any improvement in healthcare delivery is essential, especially in the current state of our healthcare environment that we're in. And a lot of what we believe in is the patient is the center of all we do, and the continuum of care starts with the patient and ends with the patient. So it is so essential that for that entire continuum of care, we can elicit that feedback from the patient and really know what we can do to improve the patient experience.
I think the advantage that having designers involved in care transitions can bring is we are not healthcare experts, that we really are coming in naively, but we are specialists at communication visually, physically and behaviourally, and we don't have a healthcare lens to look through. So we pay attention to different things, and we hope that our partners see the value and benefit of that.
I think the two unique things that this initiative brings is, number one, the patient and patient family involvement, which I think is a very important and missing perspective in our vision of healthcare. And the second thing is the involvement of the Michigan Integrative Design Program into this process, observing with a neutral, unfiltered set of eyes the process that the healthcare team and the patient goes through, and hopefully bring forward insights that we've not been privy to in the past.
So I think it's really a great idea to incorporate patients and caregivers in these processes, and seeing the way that this has worked today, it's just been such a valuable experience to have patients in particular being able to tell their side of the story. And I think incorporating caregivers is so important too, because they're really the ones that sort of become the patient's support system and their contact with the healthcare environment once they leave the hospital.
I was a patient not too long ago, and this group here today is doing everything they can to make the transition for people being discharged and to do whatever they can for the patient. And I'm really glad to be a part of it today.
The reason I think it's very positive is we as caregivers, as clinicians, we get too focused on our silo. We get too focused on a certain tree. Each patient is a forest. It's a complex human being who has different needs. And as they get transitioned from one facility to another in our complex healthcare systems, I think a lot of them lose their way. And it helps me as a caregiver to be more grounded, to understand their perspective, because they are why we are in this profession. And I think it's a great idea, and I wish we had more of this.